So it really is seen as the light at the end of the tunnel. Pfizer and BioNTech announcing that their COVID-19 vaccine candidates more than 90% effective in preventing the spread of the virus. It comes as the U.S. today surpasses 10 million total coronavirus infections. Here now with some perspective on just how important all this is Dr. Nicole Saphier, the Fox News medical contributor. And, Dr. Nicole, I thought the 90% number, from what I was reading beforehand, people would have been happy with a lot less than that, seemed to really stand out. I mean, this is, that's really effective, 90%. What does it all mean, though?
Well, that's right. So the preliminary data based on tens of thousands of patients coming out of Pfizer is saying that their vaccine has prevented infections about 90% of people. And let me tell you, that far exceeds expectation. Just to get the FDA approval, it needed to be more than 50%. I'm sure you remember, but the flu vaccine ranges from 30 to 70% effective every year. So this is much better thus far than the flu vaccine. However, as we see more data come out and more people get it, that 90% may not stay the same. It may get a little bit better, may get a little bit worse, but these preliminary results is great news. It's very encouraging for the Pfizer vaccine, which being an mRNA vaccine probably bodes well with Moderna, which uses a similar type of vaccine. So I anticipate to have some encouraging results from Moderna very soon as well.
Okay, so the fact that Pfizer was encouraging means that Moderna is likely to be, which is interesting. The idea that it's a two-dose vaccine, which I guess if you do the math means what it would be about 28 days before you would, have the whole, full protection, so to speak. Should we read anything into that? I mean, what should we take away from that?
Well, 2 doses or 2 inoculations mean twice as much supplies are needed, meaning 2 syringes, 2 different appointments, PPE. So all of a sudden it gets very expensive because you've now just doubled the amount of supplies that you need for this vaccine. Also, on top of that, it requires very specific storage. It has to be kept at negative 90 degrees Fahrenheit, below zero, essentially. So storing this vaccine is going to be very difficult. It's not going to be able to be stored at a lot of places that would typically house many vaccines. So these are all the details that are really going to come into the whole manufacturing and distribution now. That's what's crucial. I mean, we have done incredible in having so many companies in these late stage clinical trials, but now it gets into the nitty gritty of it and making sure that we can not only manufacture it safely, but how are we going to get it to all the people as well?
Right, that's the challenge. That's where the Operation Warp Speed from the administration comes into play in trying to get this vaccine rolled out as effectively and as efficiently as possible. If one of your patients asks, though, upon seeing this news, they might say, well, all right, we're getting there. This is certainly progress. How long until I can have my, normal life back? What would you tell them today?
So, I mean, here's the thing. This is all preliminary data. We still don't know how long the immunity lasts. They haven't broken down the data in terms of how it affects certain vulnerable populations, such as the elderly, such as those who are immunosuppressed. There's some questions that we need some answers to. We also, just like the flu vaccine, so you can get the flu shot, but then you still get the flu. But the good thing about the flu vaccine is it decreases the severity of the infection if you get it. We don't know if the COVID vaccine does as well. So when it comes to the timeline, I still want to see some more of this literature, this data. However, it does look like the frontline workers, some other high-risk people may be able to have the vaccine by late 2020, but probably more likely early 2021. I would say for the general population, I still think it's going to be spring, early summer before these are widely available. But the good news is it's not just Pfizer. We have many companies, a lot. We're going to see data within the next month or two. And so, we're going to have a lot more choice moving forward into 2021.
Interesting what you said about how effective it might be in terms of where you could still get the flu, or in this case, can you still get COVID? A question about that. So I'll go back to my original question just to follow up on it. What does that actually mean then to be 90% effective in these trials? And you probably already said this, but just to follow up, just to make it clear with people about, how effective it is or what that actually means to be 90% effective.
So that means that in 90% of the people that they've looked at the data on, it actually prevented the COVID infection. Which is great. That is significantly better than we see with the flu shot. But what I want to know is in that 10% that they didn't prevent the infection in, Was that infection less severe because they had the vaccine? They haven't stated that yet, and it's because the people who did get COVID, they didn't have severe symptoms. So more data will need to come out before we see those results. But I mean, if it can prevent it 90% of the time, and then 10% of the time it lessens the severity, I mean, slam dunk. And they also reported no safety concerns, which is vital, very key to this. So, I mean, this is all extremely optimistic moving forward, but we still need some more data before we can say for certain, I mean, answer all the questions that we may have about it.
Yeah, overall, great day for science and humanity, as the bottom of the screen says right now. Dr. Nicole, thank you. It's always good to see you. Thanks for coming on,
Thank you.
Dr. Nicole Saphier.